The Fluso ByPass Adapter is designed to improve the way clinicians manage mechanically ventilated patients. This innovative device minimizes the frequency and impact of circuit disconnections on patients as well as clinical staff. The design adds minimal dead space effect on tidal volume delivery. The main components of the Fluso system are the ventilator port, where the stationary ventilator is connected, the bypass port, where the transport ventilator or resuscitation bag is connected for transport, the patient port, where the patient is connected, a tethered cap, and an integrated swivel which minimizes torque and pull on the endotracheal tube. However, the true innovation of this technology is the swing valve, designed to redirect the gas flow without interruption of positive pressure ventilation to the patient. As gas flows through the ventilator port, the swing valve is activated, sealing off the bypass port. In reverse, when gas flows through the bypass port, the ventilator port is sealed off. The swing valve technology provides a reliable seal, ensuring the patient's breathing circuit remains closed at all times. The colored ring permits visualization of the valve position to increase patient safety. Fluso should be placed in the ventilator circuit between the patient Y and the endotracheal tube. Usage is simple and intuitive. When the stationary ventilator is connected, the flow of gas travels from the ventilator port to the patient port, with the bypass port sealed off by the swing valve. To transport the patient, simply uncap the bypass port and connect the transport ventilator. Turn on the transport ventilator and turn off the stationary ventilator. This causes a pressure differential inside the Fluso ByPass Adapter, activating the swing valve technology and sealing off the ventilator port. The flow of gas now travels from the bypass port to the patient port. Cap the ventilator port not in use with the tethered cap, and the patient is ready for transport. Simply reverse the procedure to reconnect a stationary ventilator. The typical procedure to transport a patient is to disconnect them from a stationary ventilator and place them on a transport ventilator. However, doing so can have significant negative impact on both patients and clinical staff. Fluso's main benefits are in the areas of patient safety, staff safety, and infection control. Let's examine patient safety. When a patient is disconnected from a mechanical ventilator, the lungs collapse due to the difference in pressure from the ventilator to atmosphere. This can cause severe lung derecruitment. Upon reconnection, the sudden increase in pressure rapidly expands the lungs, causing microtears and shearing known as ventilator-induced lung injury. This collapse and re-expansion is reduced when Fluso is used. Staff safety is also addressed by the use of Fluso. Bacteria and viruses within the condensate inside a ventilator circuit can escape at high velocity upon disconnection, potentially exposing clinical staff to airborne contaminants. Infection control is also addressed by Fluso. Upon disconnection, patients will passively exhale through the endotracheal tube, resulting in further infectious airborne material. Keeping the circuit closed avoids both of these scenarios and protects the healthcare team from exposure. Minimizing circuit disconnections reduces exposure of potential contaminants from entering the interior pathway of the patient ventilator circuit. Also, by maintaining a closed circuit, Fluso works in conjunction with standard ventilator-associated pneumonia protocols. Fluso is an innovation like no other. It provides a clinical advancement in patient care, protection of hospital staff and patients from infection, and an overall cost savings for the hospital. Truly a progression in the management of intubated patients. For more information, please visit flusobypass.com.